talk. Hi, my name is Jenna. I'm your nursing student. Can you please verify your name and date of birth?
Josephine Smith, 5/14/52.
Okay, I'm going to look at your wristband. I'm going to do hand hygiene and provide privacy. Do you have any allergies?
Betadine.
Okay. Today for PPE, I'm going to be wearing sterile gloves. And the provider ordered a catheter insertion today, so that will just entail me telling you about it, cleaning your peri area, and then we'll insert the catheter. Do you have any concerns?
Nope.
All right. First, I'm going to gather my necessary equipment, which is all right here. And then I'm going to wash my hands with soap and water. And then, do you have any allergies to iodine or latex?
Iodine.
Okay. And then I would check your cognitive level. You seem cognitive and alert and orientated ×4. My 12-inch catheter is appropriate for my patient's size and stature today. And do you have a history of GYN or genitourinary surgeries?
Nope.
Okay. I'm going to check your joints for your knees and your hips. Have you in a dorsal recumbent position? I would check your joints and knees for correct movement. Good. And then, do you have a history of catheters? Have you ever had one before?
Yeah, I have.
Any difficulties with it?
Nope.
Okay. And then, when have you last voided?
About 30 minutes ago.
Okay. So, next I'm going to auscultate. So, I'm just going to not auscultate. I'm going to do an abdominal assessment. So, first I'm just going to inspect the stomach. I'm looking for masses, bulges, or lesions, and none seem to be present. Next I'm going to auscultate the 4 bowel sounds. Okay. Good. And then next I would just check for bladder distension. Alright, and I'm just going to cover you back up. So now I'm just going to make sure you're in a comfortable position. Are you comfortable?
Yep.
Okay, I'm going to raise the bed to working height. So by my waist. And then I'm also going to raise this side table as well to working height so I can maintain sterility. And then I'm going to do hand hygiene and apply my gloves. And now we're going to do pericare. Do you have any concerns before we start?
Nope.
Okay. And you said you were comfortable. Alright, so I'm going to have my warm washcloth here, just exposing the area. I'm going to spread the labia and I'll go away. Me. Then move the towel and go through the middle. And then I would put that in my dirty linens. The urethral meatus is between the vaginal opening and the clitoris. So next I'm going to discard my gloves here and do hand hygiene again. Lidocaine is used for numbing the area about 2 to 3 minutes before we would insert the catheter. And next I would just make sure I have my garbage can near, and then I can start opening my sterile kit. Closer here, and this is okay. Alright, so first open my sterile kit and go away. And just making sure I'm touching the 1-inch border only. Okay, and then I'm just going to next I'm going to grab the drape by the 1-inch border. I would only make sure to grab the 1-inch border, and I'm going to step back. I'm going to have the shiny side down on the bed, so when I'm going to go drape it over, and I'm not going to break sterility, so I'm going to keep my arm outside of the leg for maintaining sterility. And now I can put my gloves on. I'll open my gloves here. Just strap that. Okay, so I'm just gonna only touch the 1-inch border, and that is stuck to the wrapping. Okay, so first I'm just going to, I'm sorry, I would grab it with my non-dominant hand to put on this hand, and I'm going to step back. I'm going to put it on, not touching the sterile part. Okay, and then next I'm just going to go under, and I'm going to make sure these two do not touch. I'm going to step back and put on this glove while I'm maintaining sterility. Alright, so now I'm just going to do that. And now that I'm sterile, I can situate my things. So I'm just going to drop that. Just going to move this. So I would be getting this out of the wrapper, and as I'm taking it out, I'm going to just palm it in my hand, or coil it up in my hand for sterility, and then I'm going to put it in my lubricant. And I'm going to take my syringe. Okay, so now that that's good, I'm going to transfer the box to my sterile field. Next, I'm going to have a friend come up above here with my alcohol swabs. And I'm going to have you come above so we don't break sterility by crossing over the sterile field.
Okay. I'm going to set this down for a second.
So I'm going to contaminate this hand now by spreading the labia, and then I'm going to take one, and without touching my hand or anything, I'm going to go down, and then I would just drop, and then I'm going to take it again, and I'm going to go on the other outside without touching anything with my non-sterile hand to my sterile hand, drop. And then the third one for down the middle, drop. Okay. So now I'm going to tell my patient to relax because inserting is beginning. So if you'll just relax, take deep breaths. When I'm inserting, I'm going to make sure that this tubing does not touch non-sterile things such as my hand or the labia. I would make sure this is more towards me, the tubing, so alright, so I'm feeling pressure, so I'm going to hold that. I would make sure that my drape would not touch the patient by having this more towards the patient, or having my sterile box like that. I would keep holding it with this hand and not touch my sterile hand to make sure that it's in. And then I'm going to do 5 cc's, 5 milliliters, and then with pressure still on it, I'm going to take it off. And then I'm just going to tug a little bit. I would insert until urine flows. The difference between a male and female urethra: a male is longer and it's 5 to 7 inches, a female is shorter, 2 to 3 inches. So now that that is in, good, I'm going to attach it to the patient's thigh. And I'm going to attach it to the bed and not the side rail with no kinks. I'm going to wipe off any extra access around that may have gotten on that. And then I would discard my gloves and do hand hygiene for this purpose. Since I'm going to be taking it off, I'm going to keep them on. The steps to a urinalysis is: check the provider's orders, wash your hands, put on sterile gloves, clamp the tubing, wait until urine flows, alcohol swab the port, and then pull out 10 to 30 milliliters of urine, and then, attach the syringe and then pull out the 10 to 30 milliliters of urine, and then put in a sterile container, label with your date, time, and initials, and then transport it to the lab. Now it's time to take it out. So I'm just gonna grab this and put it back in here. I'm gonna hold that and get out. Okay, so now that that's done, I'm gonna take my gloves off. And I would take them off normally, properly by going under, palming it in my hand, and then going under for the next one. Since these are gloves that I'm going to keep, I just took them off like that. I would say thank you. Is there anything else I can do for you today?
Nope.
I'm going to cleanse and clean my equipment. I would do the 5 safety measures, so make sure the bed's low and locked, side rail secure, call out within place, side table near, room risk-free of falls. I would perform hand hygiene, the 5 stages: before a patient, after a patient, before a procedure, touching patient belongings, coming in contact with bodily fluids. I'm going to clean my supplies, take it out of the room with me, and I'm going to document it in OneNote and report any norms per agency policy. Thank you.